Continuing with the anatomy of the orbit, there is a connective tissue system of the orbit which includes the periorbita, that is lining the orbital wall, the orbital septal system dividing the orbit into various surgical spaces and cavities, and the Tenon's capsule, that is lining the globe. Okay. Now is the periorbita. Periorbita is loosely adhering to the bones, the covering of the bones which is loosely adhering to it. It has a sensory innervation by the branches of the fifth nerve. It is fixed firmly at the orbital margins, suture lines, various fissures and foramina, and at the lacrimal fossa. The surgery in the orbital roof in the areas of the fissures and the suture lines may be complicated by the CSF leakage. Due to this periorbita, the orbital septal system includes the connective tissue septa. It is suspended from the periorbita to form a complex radial and circumferential interconnecting slings. These septa surround the extraocular muscles, optic nerve, the neurovascular elements, and the fat globules in the orbit. The Tenon's capsule is also known as fascia bulbi or the bulbar sheath. It is dense, elastic, and the vascular connective tissue that surrounds the globe, except the cornea. It begins interiorly at the perilimbal sclera, extends around the globe to the optic nerve, and fuses with the dural sheath and the sclera. It is separated from the sclera by the periscleral lymph space in continuation with the subdural and the subarachnoid spaces. What are the various contents of the orbit? Eyeball is not a part of the orbit, it is a content of the orbit. Eyeballs, muscles, various extraocular muscles, the recti, the LPS, the various nerves, arteries, veins, lacrimal glands, lacrimal sac, orbital fat, reticular tissue, and the orbital fascia. The extraocular muscles, there are 4 recti and 2 obliques, the levator palpebrae superioris, the LPS muscle, and the Muller's muscle. Okay, next is the orbital vessels. The primary blood supply to the orbit is from the ophthalmic artery, which itself is a branch of the internal carotid artery. There is a small contribution from the external carotid artery via internal maxillary artery and the facial artery. Okay. The main branch is the ophthalmic internal carotid artery, from which the ophthalmic artery reaches into the orbit. The ophthalmic artery is further gives a branch to the central retinal artery, which goes into the optic nerve, into the eyeball, and then it also gives the muscular branches, muscular groups. There is also a short posterior ciliary artery branches which form the circle of Zinn and enter the eyeball. Okay. Next is the venous drainage. The main venous drainage of the orbit is through the superior ophthalmic vein, and there is also an inferior ophthalmic vein which drain the orbit. And where do they drain? Into the sinuses. The nerves of the orbit. The various nerves of the orbit are the optic nerve, the oculomotor nerve, the trochlear nerve, the abducens nerve, all those nerves which pass through the superior orbital fissure and the optic canal. First and second divisions of the trigeminal sympathetics and the parasympathetics of the third and the fifth cranial nerves. The lacrimal gland. The main lacrimal gland resides in the supratemporal orbit in a shallow lacrimal fossa of the frontal bone, which we had already seen the location. The next content of the orbit is the orbital fat. It extends from the apex of the orbit to the septum orbitale. It is divided by the intermuscular septum, which connects the recti into the intraconal or the central part and the extraconal or the peripheral part. What is this intermuscular septum? It is the part of the orbital septal system which is suspended from the periorbita and forms a complex angular radius circumferential interconnecting slings. What are the various changes in the orbit with age? The infantile orbits are more diverging. Like it was in the fetal life, it was 180 degree. The infantile orbits are more divergent, approximately 115 degree than those of adults. In adults, it is just 40 to 45 degree. The interorbital distance is smaller in children and may give a false impression of squint, that is strabismus. Periorbita is much thinner, much thicker and stronger at birth than in adults. With age, it becomes thinner and less, and strength is also gone with age. The roof is much larger than the floor in infancy. The optic canal has no length at birth. That is, the optic canal is not present at birth. It is just a foramen. There is just an optic foramen. But at the age of 4 years, it is about 4 mm, and in the adults, it is about 10 mm. What are the various senile changes in the orbit? Senile changes on the orbit is largely due to the absorption of the bone, and thus the elderly skull holes sometimes occur in the roof of the orbit, the periorbita being in direct contact with the duramater at the roof of the orbit. The walls show thinning and the various fissures are also widening. Okay. So this is the end of the orbital anatomy. In the coming next week, or after that, when the squint gets over, we will study about the pathology of the orbit.